Hello everyone, thank you for inviting me to your health fair, I appreciate it. My name is Dr. Jawad. I have a private practice in Carroll Stream, Illinois. And what I'm going to talk to you today, I'm going to talk to you about, it's called auricular therapy. Now, what's auricular therapy? Auricular therapy is actually acupuncture for the ear. Okay, now you're familiar with, I'm sure, about acupuncture for the body. What I do, yes, I do that. But also what I like to do with my patients, it's called auricular therapy. Auriculotherapy, I do the acupuncture needles in the ear. Okay? So, first and foremost, thank you for spending the time learning. I appreciate it. Again, I like doing these health fairs. If you know anybody else who is looking for somebody to talk on their health fair, please let me know. You can always get a hold of me somehow, some way. Okay, I'm all over Facebook and Google, and I'll go over that later on. And first and foremost, please ask any questions, because if you're thinking about a question, somebody else is too. So if there's any questions, don't be afraid to raise your hand. Okay, so who am I? Who am I? Okay, I'm just some guy talking. Actually, not really. I graduated in 2003. I'm a chiropractic physician. I graduated in 2003 from National University of Health Sciences. That's the chiropractic school in Lombard off Roosevelt. Formerly not the National College of Chiropractic, but they did do a name change, so it's National University. I was an associate for a couple of years downtown. I learned a lot from my clinician downtown, my boss downtown. So much that I actually branched off from him and I moved to Carroll Stream. I grew up in Oak Park. Moved to Carroll Stream. I opened up my own practice in 2006. I'm in Carroll Stream right around Geneva and County Farm Road. And I kind of got bored just being in private practice, so I extended my education, and I have a fellowship and I have a diplomate. And people always ask me, well, what does all that mean? And I just say, well, that just means I'm kind of smart with a bunch of initials after my name. A fellowship and a diplomate, they're the highest level of education that you can achieve in your given field. So I always say I'm kind of smart. I know more than the average duck. I don't believe that in myself, but hey, my initials prove it. So, also, I'm an adjunct professor, part-time professor over at the College of DuPage. I teach human anatomy and physiology to a lot of the up-and-comers who are going to the healthcare industry, a lot of nurses, physical therapists, anybody who needs human anatomy and physiology for their credit hours. Yes, I teach them, it's great, it keeps me young. So let's get started. So what is it? Okay, what's acupuncture? And what's ear acupuncture? It's a modern treatment. It's a modern treatment. It's very, very natural. Acupuncture has been around for thousands of years. Actually, acupuncture, 33% of the world is still uses acupuncture for a primary means of healing. Because what does it do? It heals the body naturally. It improves, what does it do? It improves the body and brain function. It alleviates health conditions in other parts of the body. What I'm doing, I'm stimulating the ear to treat illnesses recommended in ancient Chinese medical textbooks dating back over 2,000 years. The ear is a very, very powerful organ. Okay. Facilitation and detoxification from drugs and alcohol. I do a lot of detox from drugs. Alleviation withdrawal symptoms. Also too, with weight loss, I don't do weight loss. Okay? I do reduction of cravings. So I don't do acupuncture for weight loss, I reduce the cravings of foods, alcohol, drugs. It all works the same part of the brain, I'm just stimulating that part through the ear. So what is it? One of the regional therapies which is used broadly in Oriental medicine. This is the ear. Okay, what it could be. I always like pictures of my slides, it keeps people engaged. Ed's 1 second acupuncture treatment, ready? And here's this guy, he's going to throw a porcupine on his spine for his one treatment fix. I don't do that in my practice. I would like to do it in my practice. It'd be a lot easier on me, but I don't think it's very, very effective, and also I like my license. So I think I'm scared of needles, so it seemed like a good option. The Voodoo Doctor, again, people always come back to me and say, hey, you know what, I told my friends about you being an acupuncturist and a chiropractor, and they always refer, I have a patient of mine, I treated low back pain, and he owns his own business, and when his low back pain gets inflamed, his coworkers always say, hey, you should go back and see the Voodoo Doctor. So, yeah. Okay, so what is it? Development of auricular therapy. It's a systemization by a doctor named Paul Nogier. He's French. French doctor, he got a hint from an episode when a patient got burnt in the ear and healed its sciatic by itself. He said something's there. A guy got burned in his ear and it helped his low back pain. So he applied this phenomenon to his clinical practice and reported his positive results to the Congress in 1956. And what he observed a somatotropic inverted fetus pattern of points which correspond to the pattern of the actual physical body. What does that mean? What does that mean? That means that the easiest way to describe it is that it's the inverted baby. The inverted man in your ear. The head, again, if you're going to get your ear pierced, okay, so the piercing, that's the head, okay? I can treat the head all the way from the shoulders to the lower spine, to the legs, to organ systems. Organ systems. My own personal story, okay, back in 2013, I have a hip replacement, total hip replacement on the left side. My personal story with acupuncture is that I helped my hip pain by sticking needles in the hip area of my ear. I helped alleviate my hip. Now again, I didn't cure it because my hip was degenerating. But what I did, I was able to control the pain, so I was functional. In addition to that, I got a rotator cuff tear. So I said, hey, well, since I'm sticking my ear from my hip, might as well hit my shoulder. So I alleviated, and I still have the rotator cuff tear. It does hurt on occasion, so when it does act up, I do the shoulder point to my ear to help alleviate the symptoms. Okay, so again, the ear is a microsystem of the body. So what is acupuncture all about? You may have heard this strange word called the chi. It stabilizes chi. Chi meridians. They're energy pathways of our body. We have 12 pathways of our body that extend from one side of the body to the other. It's like a 12-lane highway system, as is described in Chinese medicine. They congregate in or have connections right to the ear. Right to the ear. This is how we're able to do it. So ear acupuncture stimulates the movement of vital chi energy. When we are in sickness, illness, and disease, what does that mean? That means that the chi, the internal energy, is disrupted. So what acupuncture does, it helps stabilize that, revitalizes it, corrects it. Through meridians, it facilitates a state of balance and harmony that the human form naturally desires. You may have heard of words called the yin and the yang. The yin is the female energy, the yang is the male energy. It's a balance. And when you have sickness, illness, and disease, that balance is in disorder, disharmony. So it helps balance out the yin and the yang. So interruption and rerouting of the neural messages stimulates the endorphin release. Now, endorphins, if you don't know what endorphins are our natural pain suppressants. It makes us feel good. When you go down the roller coaster, that first drop, the reason why it feels so good is because you have stimulation of endorphin release. Endorphins are natural pain suppressants. Okay, so this is one of the key things about ear acupuncture. This is why I help. This is how I help my patients. I stimulate endorphin release. Also, too, some of the intended effects. Restoration of equilibrium. It helps balance out your system. Because remember, when you're in pain, you're off kilt. So it helps balance out the equilibrium of the body. Restoration of energy and vitality. Relief of restlessness. Reduction of hypersensitivity. Anxiety, relief of pain, promotes sleep. I have a lot of people come in with sleep disorders. Then I use acupuncture, and they come back and say, wow, I can sleep now. Pretty remarkable. Promotion of physical and psychological well-being. All through the ear. So, the difference between auricular therapy and acupuncture, okay? It's still in the same realm. Auricular therapy is a separate entity altogether from acupuncture because it doesn't rely on the meridians. Now, acupuncture, I do body acupuncture. I do stick needles in the body, and that's the meridian system. We have 12 meridians, okay? Auricular therapy is just strictly to the ear to create change. No meridians enter the ear. The points only appear when there is some physical or functional disorder in the part of the body represented by that region of the ear. So there are meridians that go to the ear, but I don't focus on those. So the anatomical arrangement of the ear points are based solely upon the inverted fetus. The inverted fetus, the upside down baby. So body acupuncture lie below the skin surface, whereas the ear reflex points reside in the shallow depth of the skin itself. Many body acupoints are stimulated directly over the same body area as where the symptoms is located. So auricular therapy versus acupuncture. Again, to go back into the ear, one of the reasons why the ear is so powerful, because auricular therapy points are expressed by 4 cranial nerves. Now cranial nerves, they're just basically the wiring system that helps control the brain in conjunction with the body. Again, we have 12 cranial nerves, okay? I'm sure you may have heard of them. If not, we have 12 cranial nerves. Yes? Yes. Okay. So again, we have the facial nerve, which is cranial nerve 7. We have the trigeminal nerve, which is the 3rd division of cranial nerve 5. Glossopharyngeal nerve, which again, that helps the throat. And the vagus nerve, which is the longest nerve of the body, that's number 10. Correct?
That's right.
Okay, good. I just want to make sure you know. All right, so I'm stimulating the nerves through the body. Again, this picture is not as great as I want it to be. Again, but you can see here, it's the upside down man. Okay, it's upside down man. It's not the greatest picture. It's hard to, and I gotta apologize. It's not the greatest picture. But again, the ear is a microsystem of the body. Okay, and there's better pictures. It's just hard for me to get a picture on the screen. All right, so what is it not? I'll tell you what it's not. Gee, Doc, I feel great, but all these needles keep on getting in the way of everything I do. I'm not sticking you and leaving you go. Not in your body, at least. So what happened? So in 1990, the Director General of the World Health Organization proclaimed at an international gathering that auricular acupuncture is probably the most developed and best documented scientifically. All the microsystems of acupuncture and the most practical and widely used is ear acupuncture. I like it, I love it. I also do scalp acupuncture. We do have a system in our scalp of the body, which again, I use that in conjunction with the ear. It just makes, for me, it just makes it more logical to do with certain body points. The microsystem therapy of auricular therapy. Okay, so the microsystem reflex map of the body replicates the anatomical arrangement of the whole body. What it is, the word soma. Soma means body, and topography refers to the mapping of the terrain of the area. So microsystems are connected to the somatotopic neurological reflexes in the brain, where a picture of the homunculus or little man can be identified by brain mapping studies. We have a map of our cells in our brain. It's called the homunculus, otherwise known as the little man. So the ear to the brain connection is the shortest and most direct of any neurological microsystems, and all other microsystems such as the foot reflexology and acupuncture are indirect. What that means, we sense everything right here. The closest system from here is your ear. Your body points, yes, I can make a profound effect on the body change through sticking a needle in your toe, between the first 2 toes for stress, chronic stress, or in the bottom of your foot, the kidney 1 point, for pain and endorphin control. However, I have to rely on the condition of the patient for the transmission to the brain versus right here. The shortest distance between 2 points in a straight line. So again, here, auricular therapy. We sense pain and we sense everything in our brain right here. Your ears right here. Okay, let's go work it. Okay, so the neurophysiological basis. For chronic illness to maintain itself, the disorder must be accompanied by altered neurological reflexes that transmit pathological messages to higher nervous centers. Basically what that means is a habit is formed in the nervous system where it goes on a vicious loop, going round and round and round and round and round. This is called chronic pain. When that chronic pain just goes, continues. Why is chronic pain has got to be the hardest thing to change? Because now it's a habit. It's a habit. You're used to chronic pain. It's dull, it's achy, it's always there. And the hardest thing to change that chronic pain because now your body's hardwired. This will continue. It will continue unless the neural circuit is corrected. This is why it works. I'm creating change. What I'm doing is that for the people over 40 who remember what record players are all about, sometimes you get a skip in the record and that lyric will just go over and over. That's chronic pain until somebody comes around and hits it. That's what acupuncture allows. So common treatment points. Again, I usually do this. Here's some common treatment points. A point called sympathetic. Corrects imbalances in the nervous system, provides analgesia, and reduces intestinal contractions. Again, if people have any type of intestinal disorders, I do the sympathetic nervous system. The sympathetic point, again, controls the whole body. We have two sides of this nervous system, the sympathetic and the parasympathetic. It's where the rest and digest or fight or flight response. Shenmen. Shenmen's a very powerful point. It includes a common effect, alleviates insomnia, restlessness, and general hypersensitivity. These are just some common points that I use. And again, some of these points are also body points. Kidney points, aids in digestion and metabolism. The liver regulates blood circulation, improves metabolism, digestion, and stomach function, and provides, again, pain relief. And the lung regulates breathing, temperature, and circulation. Treats bowel disorders such as diarrhea, eliminates night sweats. And again, all these, now again, remember, when we're in chronic pain, these organ systems play a huge factor when you're in chronic pain. Think about when you're in chronic pain, your blood gets acidic, okay? What filters the blood? The organs that filter this blood are your kidneys, your liver, and lungs. So when you're in that chronic pain, you're damaging these systems, okay? So, if there's a point to stabilize it, that makes sense, doesn't it? Yeah, these are the main points. Okay, again, really small. They're right here. These are the main points I use. Yeah, they're very small. They're not big. So what do I use? In my practice, what do I treat? How can I help you guys? How can I help the patient? Again, anything with addictive behaviors and drug detoxifications. Pain control, head and neck pain, body and limb pain, physiological and stress-related disorders, neurological disorders, female disorders. Female disorders ranging from, again, dysmenorrhea, painful periods. I have a lot of my ear patients, my female ear patients, they come to me when they're right around their period. There is a point for the uterus in the ear that I stimulate, and it helps them with that cycle. Okay, irregular cycles can be helped with acupuncture. It can help. It's documented, and I use it. I use it a lot. Allergies in the Midwest, we have a lot of allergies. We have a lot of hay fever. We have a lot of pollen and dust fluctuations. Acupuncture helps stabilize. So the brain-computer model. This is this what helps me understand it even better. So imagine your brain is a computer. Okay. The ear is seen as the computer terminal, peripheral access to central processor, okay? So accessing the points on the ear is like typing a message to gain access into the system. So detecting the active points is like looking at the screen of the computer. Losing the ear would not stop the computer from working, it just means we lose the means of communicating with it. And if you lose an ear, we have two ears, I could stimulate the other ear to still have a profound effect. Again, so here, the ear is a microsystem of the body. This is a better picture. You can see it's the upside down man. Again, I can do certain organ points on the ear. Again, if there's anything that you guys have, sore shoulders. I had a patient of mine, he was going through prostate dysfunction. Okay, he didn't have prostate cancer, but he had prostate problems. There is a prostate point for the male. Constipation. Okay, again, calming, tranquilizer points, so forth and so on. All I can do through the ear. I help a lot of my patients with acupuncture through the ear. So healing, not just pain relief. It does not simply reduce the experience of pain, it has a more immediate effect. Immediate. It stimulates the natural healing process of the body. It diminishes the overactive body functions and it increases the underactive body functions. So what we're doing, we're calming down the overactive body, holy calm and pain, and we're bringing up the inactive, the yin and the yang, the balance. I'm balancing out your system through acupuncture. Benefits. The benefits of acupuncture are vast, and this is just an example of some of the benefits. It's a drug-free natural pain relief. Nowadays, what happens when you go to your medical professional? They want to give you a what? A script. They give you anti-pain, antispasmodic, okay? Anti-pain, antispasmodic drugs. Drugs. This is a great way to heal the body without drugs. It speeds up the neurological healing process towards wellness, helps to isolate dysfunctional internal systems and tissues, releases endorphins. Endorphins are natural pain suppressants. When you release endorphin, yes. Actually, you know what? Forget about acupuncture, just go to Great America. And just go on the roller coaster rides. That's a great pain relief. Tells the body it's storing stress and helps relieve tension. It helps assist addictions of all kinds in the recovery process. A good part of my practice is addiction recovery. All right, exactly. Again, here's her Stickin Balls. This is actually kind of funny because this is originally how acupuncture started off. It's actually not by the Chinese, but actually by the Indian culture. And what they did, they used sharpened bones, and they poked certain areas to help alleviate the pain. So yeah, this is kind of symbolic of where it all began. So, again, thank you for your time. I appreciate it. Is there any questions?
Oh, can you please start on?
You want to try?
Yes.
Okay. Is it okay? Do you guys want to see a demonstration? Okay, yeah, sure. Come on over. Yeah, come on over.